Did you notice? We've done some redecoration here in the studio during commercial break. Pink lights behind me for, well, you guessed it, Breast Cancer Awareness Month. It's a disease that can be detected early, and the treatment technology has advanced by leaps and bounds in recent years. Our friends at Baton Rouge Clinic are leading the charge in the fight against breast cancer.
My name is Everett Bonner, and I'm a breast surgical oncologist at the Baton Rouge Clinic. Breast cancer is pretty prevalent in women. In fact, it is the #1 incidence of all cancers. 1 in 8 women will be diagnosed in their lifetime with breast cancer. That's about 11% of the population. And so what's important about Breast Cancer Awareness Month, it's just a reminder for women to get their annual mammogram. And that's why it's very, very important to get it, mainly because early detection saves lives. We know that women who get detected in stage 0, 1, or 2 have somewhere between a 90 and 95% cure rate. And so it's why the mammograms are so important and why it's very important to get those done on an annual basis so we can catch those cancers early and we can make a big difference in your treatment plan as well as decreasing chances of having to go to chemotherapy or more aggressive type treatments. There is a concern on women on getting an annual mammogram. Is the discomfort of mammograms. Now, I can't be naive to say that it's not uncomfortable. However, the benefit of the small amount of discomfort that most women will have, some women it's more severe, but most women don't have a big issue with it. It's a very quick exam. Nowadays, with our newer techniques, the compression is not as intense, and with a 3D mammogram, we can get a lot of our imaging, not have to spend a whole lot of time getting multiple images. We can do it all in one shot. And with the 3D, we can actually see through dense breasts. And so it limits the amount of exposure, and it also limits the amount of time that those breasts are in compression. There's been a lot of controversy on when women should start doing their mammograms. We have found through our societies and data that 40 is the age that we should start doing mammograms for average risk women. Women who have a higher risk, who have family history or other risk factors that increase their risk of breast cancer, genetic mutations, exposures, they should do their mammograms earlier. That's a good way to talk with your doctor of when you should start if you're not of average risk, which that age is 40, if you should start years earlier. One of the misconceptions about breast cancer is that if I don't have a family history of breast cancer, if I don't have a genetic mutation, I'm not at risk. That's actually a false statement. 80% of all breast cancers are women who have no family history or no genetic predisposition. That's so knowing your history is important if you're a higher risk when to get screened, but also even if you don't have a family history and no one in your family's had breast cancer, you're still at risk. Like I said, 80% of breast cancers are in women who have no family history or genetic mutation. One of the greatest things about especially early detection is that when you have that call and it's an early detectable cancer, you have so many great treatment options for these patients, and their survivability is in the mid to high 90%. And so even though I'm giving them very bad news, there is a lot of hope and a lot of good treatments out there that these patients will survive. And that's one of the greatest parts of my job is when after I give them that diagnosis and we go through the treatment process and then we can tell them, hey, you're cancer-free and you're cured. That's one of the greatest benefits of having this job and being a cancer doctor. One of the great things about Baton Rouge Clinic is the uniqueness of the people who are taking care of you from a breast cancer standpoint. We have the latest and greatest 3D mammogram, which is the state of the art for cancer detection. One of the other things that's very unique about the Baton Rouge Clinic is that most of our mammographers are either breast cancer survivors or a high-risk breast cancer. So they get their mammograms done usually every 6 months, if not every year. So there's a unique relationship between the person who's doing your mammogram. They're also cancer survivors or high-risk patients. And so there's a bond there with the patients that come to the Baton Rouge Clinic. One of the other things that some people may not know is that I'm the breast surgeon at the Baton Rouge Clinic, and my wife has had breast cancer. So we have an intimate relationship with our patients because we've been there, we've been on your side. And I think that's what makes Baton Rouge Clinic special, getting your mammograms and getting your breast care here, is that not only are we the providers, but we also have our own family members who've been diagnosed with breast cancer.